Hello all, this is Priyanka, nursing tutor from Vail Nursing College. So today we are going to learn the Glasgow Coma Scale. Don't worry, it's much easier than it looks. Let me ask you something. Imagine you are in the emergency ward. A patient is brought in after a head injury. If a patient cannot speak, cannot move and barely opens their eyes, no long history, no time to think, what's the first thing you want to know? Is the brain functioning? That's where the Glasgow Coma Scale becomes your quick life-saving tool to give a voice to the silent brain. Think of GCS as a simple way to check how well the brain is responding. We are just looking at three things, that is eyes, speech and movement. First we'll see about eye response. So eye opening, look at the patient. Are the eyes already open? That's the best. So you can give score 4. If not, call their name. If they open eyes to your voice, give 3. If they open only when you apply some pain, on that time you can give score 2. And no opening at all. There is no response in the sense you have to give score 1. So here more response means a higher score. So next we'll see verbal response. Talk to the patient, ask simple questions like name or place. If they answer correctly, you can give score 5. If they are in a confused state, you can give 4. If they say unrelated words, you can give score 3. If they only make some incomprehensive sounds, you can give 2. And if there is no response, you will give score 1. Okay, next one is motor response, the most important part. Ask the patient to do something simple like show me your hand. If they follow, that's 6, that is best score. If they don't follow but try to push away, it's 5. If they just pull away, we can give score 4. If there is abnormal flexion, you can give score 3. And if there is abnormal extension, that is 2. And if there is no movement, you can give 1 score. Once you finish all the 3, just add them. For example, eyes open to speech, so that is score 3. If the patient is in confused speech, that is 4. Obeys commands to motor response, that is 6. So total becomes 13. Now how do we understand the total? 13 to 15 means mild condition. 9 to 12 is moderate, 8 or less is severe, and this is very important because the patient may not be able to protect their airway. So one important, never write only the total, always write like E3, that is eye opening 3, and V4, verbal response 4, M6, motor response 6, and which equals to 13. This helps us know exactly where the problem is. So in practice, keep it simple in your mind. Look at the eyes, talk to the patient, ask them to move, and then add the score. That's all. So GCS is just a step-by-step observation, not something to memorize. Thank you.